And it's great to see so many of you here this morning on a very wintry morning in New York City. And we want to welcome you to the launch of SAGE's National LGBT Elder Housing Initiative, a first of its kind effort to dramatically improve housing opportunities for LGBT older adults across the country. This initiative is, I think it's fair to say, desperately needed. As the federal government recognized in establishing the National Resource Center on LGBT Aging 5 years ago, LGBT older adults are among the most vulnerable, challenged, and marginalized of our older communities in this country. And among the most serious challenges faced by LGBT older people are severe isolation, thin support and care networks in the later years, health disparities and poor access to effective health care, higher levels of poverty, and discrimination and barriers to accessing services. And, as you will learn this morning, because of discrimination, LGBT older adults face severe challenges when it comes to accessing affordable and welcoming housing in their later years. Today's national initiative builds on important efforts in a handful of pioneering cities across the country that have led the way in building LGBT welcoming housing, in training housing providers, and in educating LGBT older adults on their housing options and rights. But now the time has come to replicate and expand those efforts through a national strategy that changes the housing landscape in every community across this country for LGBT older people. And SAGE is proud to join with our partners today in launching that initiative. Now, for purposes of clarity, I do want to state that today's announcement does not include discussion of a specific LGBT elder housing development in New York City. That will come at a later date. At a later date, we will be announcing plans by SAGE and Help USA to build New York City's first LGBT elder housing, which will be located in the Bronx. Mayor de Blasio and the New York City Council have been strongly supportive of these efforts, but since it would not be responsible to publicly announce such an important project before financing is in place, public discussion of that project will wait for a later date. So today's focus is on this national LGBT elder housing initiative. And I want to say that the importance of this initiative is illustrated by the extraordinarily distinguished group of speakers and panelists who have come together here today from across the country to join us and to discuss today's launch. We are thrilled to have support from the federal government in this effort, as represented by HUD's participation in today's program. We're equally thrilled to be joined by SAGE's 3 national partners in the national initiative, the Equal Rights Center, Enterprise Community Partners, and Help USA, as well as key leaders of local efforts across the country in this field. So the format for today's event is as follows. First, we will hear briefly from 2 very important speakers. Then we will turn to a brief panel discussion of LGBT elder housing issues, and I will introduce the panel at that time. And we will then roll out the initiative work plan in general terms through a few slides. And then we will open it up to question and answer from the media first, in case anybody is on a deadline, and then from anybody else in the audience who has a question they would like to ask. So now, it is my great pleasure to introduce to you somebody who I believe needs no introduction, Edie Wenzer.
In what follows, I use we and us and our to mean variously SAGE and me, or SAGE and affiliates or partners, GLBT community, etc. This is an effort of many, and I'm proud to be part of it. I'm very excited about the housing initiative and have been engaged and concerned about this issue since the 1980s. After the past 5 years, when I've been focused first on the documentary that tells the story of my beloved spouse, Thea, and me, and then being extremely concentrated on marriage and my Supreme Court case, I have had to spend some time catching up. So I spent the weekend looking back, rereading everything starting with our 1990s entry into the White House Conference on Aging. And this was done via aggressive attendance. Nobody came looking for us, okay? And that wonderful 1995 White House post-conference on aging forum that focused specifically on LGBT seniors and argued that the presumption of non-discrimination is not enough, and that discrimination on the basis of sexual orientation needed to be addressed specifically, because the continual heterosexual presumption contributed to the invisibility of gay elders. For the first time in its history, which was established by Harry Truman in 1950, the White House Conference on Aging included gay men and lesbians as a, quote, special population in its report. Sexual orientation was added to the list of categories of non-discrimination in the anti-discrimination statements that the conference issued. Every list of our policy issues begins with the same first two: healthcare followed by housing. And now I'll stick to housing, our super subject today. I read 1998's, quote, second draft of the task force, National Task Force's outing age policy issues facing old LGBT people. Then I concentrated on its housing section related to senior housing problems in general and identifying the ways in which then current remedies often fail to serve us LGBT people adequately. I moved on to September 2011, quote, integrating LGBT older adults into aging policy and practice, produced by the Gerontological Society of America and published by SAGE. The editor of this report begins with, given the voluminous gerontological literature that has built up over the past century, it's hard to imagine that any set of aging populations has been largely ignored and under-investigated. Yet this clearly appears to be true in the case of LGBT older people. These people have remained nearly invisible to the community of advocates, researchers, practitioners, administrators, and politicians who associate themselves with the modern aging enterprise. Yet forward steps are being taken to address this array. I'm still quoting this guy. Forward steps are being taken to address this array of overlapping concerns. SAGE has pressed for involvement and inclusion in a host of associational and political events. And simultaneously, SAGE Matters in the spring 2011 announced, 1, for the first time in its 32-year existence, SAGE owns its own home. We are in it right now. 2, the second big event was The Future of Aging is in Our Hands, our first ever national conference planned by, for, and about LGBT older people. This constituent-led conference, I was a major factor in that one, drew people from all across the country. And 3, SAGE launched the federally funded National Resource Center in partnership with 10 organizations nationwide. SAGE continued to strengthen our work at the federal level and increased our advocacy activities in New York. Through our new office in DC, we started working with our Diverse Elders Coalition allies to fight for a reauthorized Older Americans Act, and then aiming to get us specifically named in the reauthorization. And last year, SAGE, in partnership with the civil rights organization Equal Rights Center, published the results of a 10-state investigation documenting adverse differential treatment against older same-sex couples seeking housing in senior living facilities. This all brings me to our purpose today, and I am thrilled to turn this over to our handful of experts in every facet of housing for older LGBT people.
Okay, thank you, Edie. And it is now my pleasure to introduce Jennifer Ho, Senior Advisor for Housing and Services at the U.S. Department of Housing and Urban Development.
Well, I'm a little starstruck. No wonder the Supreme Court couldn't but do the right thing. It's a great pleasure to be here today. I work for the HUD Secretary, Julian Castro, and I'm his senior advisor on housing and services, basically all the places where we think about housing and healthcare together, homelessness, on disability, and on aging. I also, when Raphael Bostic left HUD as the Assistant Secretary for Policy Development and Research, I inherited the internal title of Principal Queer. So it's a real pleasure to represent HUD with you today, but really more than anything to have an opportunity to be with you all as we challenge ourselves and the nation to think about what we do about creating more affordable housing options for aging LGBT Americans. We're all aging. It's a fact. But those of us in a younger generation really owe it to people in an older generation who have cleared the path, made it possible for someone like me who's out to hold a political position at a place like HUD to be able to work in an administration where I have been able to be proud of the policy decisions that they have made one after another. I won't recite them to you today. I trust that you know that this is a very, very LGBT-friendly administration, and the first time ever that a president has actually talked about lesbians, gays, and transgender individuals in a State of the Union speech. It was a proud moment for me and my team as we sat and watched. There is an affordable housing crisis in America, period. More than 8.5 million Americans spend way too much of their income having a place to stay. America is aging at a rapid pace. And what we see is that as Americans age and lose income, in collision with this affordable housing crisis, is that there is a huge problem that we need to begin to solve today. I want to piggyback onto that, the problems of discrimination, the problems of cultural competence, the problems of access to good care and to good social supports that are uniquely faced by folks in the LGBT community. I believe that now is a time when America is going to have to confront the fact that we need to do something to accommodate a range of housing options and social supports for people as they age, and that the needs of the LGBT community can be front and center in helping to define what that looks like. I'm excited about places like where we stand today, where you see this full and vibrant service center that creates an opportunity for people not only to socialize and to get some of their technical needs met, but also to express their creativity and their passions and their joys and their aspirations. And I know that every single day, people are confronted with discrimination and harassment and a sense that their choices are limited, because even though our law says that there are rights and our rules say that there are rights, that's not the way that it's practiced in every community across the country. It's not the way that it's practiced by every housing provider across the country. So I just want to thank you for what it is that you're doing together today. And I want to let you know that, that HUD stands with you. And if there's more that we need to do, we're open to hearing that. Are there things that we can just do with you? Please continue to invite us along. Very much looking forward to participating in the White House Conference on LGBT elder housing that's happening next Tuesday. I'm excited that my secretary is going out to Denver for the LGBT Equality Conference. So really, more than anything, thank you for your leadership on this really important issue, and just know that we in Washington, D.C. are working just as hard as you are on it, and make us smarter by letting us know what to do. So congratulations on this launch event. Thanks for having me, and looking forward to participating.
Thank you, Jennifer. And now we are going to begin the panel discussion, and I'll start by introducing the panelists from your left to your right, and then I'm going to ask each of the panelists a couple of questions to help elucidate the conversation today. So to my immediate left is Melissa Rothstein, who is the Deputy Executive Director of the Equal Rights Center, a national organization that has battled discrimination in housing since its founding in 1983. Next to her is Cheryl Gladstone. Cheryl is the Program Director for Senior Housing at Enterprise Community Partners, a national organization that creates opportunity for low and moderate income people through affordable housing in diverse, thriving communities. And the next to Cheryl is Cheryl Wayland. Cheryl is the Executive Director of Sage Metro St. Louis, one of 27 SAGE affiliates across the country. Next to Cheryl is Kathleen Sullivan. Kathleen is the Director of Senior Services for the Los Angeles LGBT Center, the country's, and I'm confident the world's, largest LGBT organization. Next to Kathleen is David Cleghorn. David is the Senior Vice President of Real Estate Development at Help USA, a national innovator in supportive housing since its founding in 1986. So let me start with a question for you, Melissa. Can you briefly tell us the Equal Rights Center's 2014 study, which Edie Windsor referred to regarding the experiences of LGBT older people? Can you briefly tell us about the high points and what was learned from that study?
Sure, thanks, and thank you for letting us be a part of this event. The Equal Rights Center, in close collaboration with SAGE, did complete a national study of civil rights testing in 10 states, investigating the rate of differential treatment afforded to same-sex couples seeking housing in a 55-plus independent living community. In each test, there would be 2 testers who contacted the same housing provider. First, a lesbian or gay identified tester who would ask about housing for themselves and a same-sex spouse. And then a non-LGBT identified tester would inquire about the exact same housing for themselves and an opposite-sex spouse. And we had pretty shocking results. In 96 of the 200 tests, or 48%, the tester inquiring about housing for themselves and a same-sex spouse experienced at least one form of adverse differential treatment compared to the tester inquiring about housing for themselves and an opposite-sex spouse. And in 12.5 of the tests, there were 2 or more types of differential treatment. And the types of differential treatment that were found included information about fewer units available to the LGBT, the same-sex couple tester versus the opposite-sex couple tester. That housing agents would tell them about additional fees and costs, often a more extensive application requirement, possibly requiring that individuals apply separately as opposed to together, even though that they were clearly a couple intending to live as a married couple. They would provide information about additional amenities and specials to the tester of the opposite sex couple then that they did not mention to one of the same sex couple, and again there would sometimes be additional application requirements.
Well, what this study documents is that in 48% of these tests involving older same-sex couples across the country, there was some form of discrimination when applying for housing. That's shocking, as Melissa said, and that's an important part of why we're here today and what we need to change. So I want to ask you a follow-up question, Melissa, which is, what needs to happen to protect LGBT older adults from this kind of housing discrimination?
Sure. Well, first and foremost, there needs to be more legislation that prohibits housing discrimination based on sexual orientation, as well as gender identity, although our testing did only focused on sexual orientation. There is a patchwork of protections that at the state and county level throughout the country, and to the extent that there are protections in places, that those also need to be enforced or at times strengthened to have better enforcement mechanisms. There should be, senior housing communities should have anti-discrimination policies, just like other housing communities, that should include sexual orientation and gender identity within them. And both the staff of the housing providers as well as individuals should know their relative rights and responsibilities, and the resources that are available to address discrimination issues. And that's actually a big part of why we're so excited to be part of this initiative.
Before moving on, we thought it would be really helpful to really introduce you by video to 2 of the 2 million LGBT older adults who live in this country who have struggled in really very serious ways to find appropriate housing. And they are Sophia Torres of New York City and Marty Smith of Chicago.
I presently am residing at a shelter, and I am seeking a place to call my own. I've been in a lifestyle since I was about 14 years old, and I've always been a nonconformist and a militant and that sort of thing. and a pioneer breaking into men's work field. I came here to Sage in December 2013 after I relocated back from Vegas. I came back to New York thinking it was still 2001 when I left. To come here and find out that I felt like everything was, just going like at a pace where I couldn't keep up, and I was so overwhelmed. I was progressively not going anywhere. Just thinking about it kind of makes me emotional, because at that point in my life I knew that I just wanted to end it all. I just couldn't keep up. And Sage was a refuge to me. They heard me out. They tried to help me in every capacity that was feasible. And I just want to go on with my life because I'm not getting younger. Every minute is very important to me, I want to move on, and I don't want to be stagnated or sit there and wait, I want to be happy.
My name is Marty Smith, and I live in the new gay-centric town hall apartments in Boys Town in Chicago. And I'm 69 years old and a card-carrying lesbian. Well, I'm no expert on the numbers, but I think it has shown that some of the older, some of the seniors who are LGBTQ are in serious financial straits, and for various, of course, life reasons. And then there is the issue of having a place to go where you can maintain your dignity, where you can continue to, in fact, be out and gay. And there are a lot of places where, whether they be independent living, assisted living, nursing homes, where, in fact, people, in terms of their sexual orientation, they disappear. And that's because of their fear of discrimination by both staff and other residents. And there are a lot of horror stories about people who have issues, and even people who are not seniors and living in apartment buildings maybe can tell you stories about that kind of thing. So I think the most important thing to me is the concept of being able to be out and living with dignity.
Sophia Torres, who was the first person featured, as mentioned, is a resident of New York City, who was homeless because of difficulty finding a place to live that was welcoming, and after a great deal of struggle, we were able to work with her to find housing for her here in New York City. Marty Smith is a new resident of Town Hall, which is an LGBT elder housing community that is new in Chicago and that has been built by Center on Halsted and the Heartland Alliance in Chicago. I want to turn now to Cheryl Gladstone of Enterprise Community Partners and ask you, Cheryl, what kind of difference can public policy make in addressing the needs of LGBT elders in housing?
So Enterprise Communities Partners has been around for over 30 years, and we have financed over 34,000 units of affordable senior housing, similar to the housing that you saw Marty living in Chicago. As Jennifer referenced, we are in the middle of a housing insecurity crisis, meaning that far too many people are paying more than 50% of their income on rent. And we're kind of used to that, or maybe that's not so shocking to us here in New York, but if you think about this on a national level, it's pretty intense and serious. And if you think about this in terms of the LGBT older population, this statistic is particularly damaging. So from a policy standpoint, we're really looking forward to helping to protect some of the key housing policy initiatives that are out there that help create and protect affordable senior housing, in particular the low-income housing tax credit program and the HUD 202 program as that continues to evolve, particularly under Jennifer's leadership. We look forward to working on a policy level to ensure that these critical housing tools continue to help create and preserve affordable housing across the country. And very much looking forward to working in partnership with SAGE. We really believe that thriving, diverse communities are what we're about, and we really believe that LGBT older adults are a part of that.
Cheryl, can you talk with us a little bit about, in your experience and in Enterprise's experience, what kind of difference can training make to change practices in the housing sector?
Yeah, so I think even though I'm really excited this is a housing initiative, but as we know, we're never going to build our way out of it. So we're never going to be able to build enough housing to meet the needs of the low-income population, much less the needs of the low-income LGBT population. So recognizing that housing is enough and we're never going to build enough of the units like we see Marty living in, what can we do in terms of ensuring that we're building the cultural competency so that LGBT people, no matter where they live, can work with people that are culturally competent, can live in housing that is culturally competent, can work with caregivers that understand their complex range of needs. So we're really excited in the coming year to work with SAGE to develop tools, trainings, webinars to help train not only the housing workforce, but also the caregiver workforce to ensure that all the housing that Enterprise is responsible for touching and creating is culturally competent and meeting the needs of the LGBT older population.
Great. Thank you, Cheryl. And certainly from what we heard from Melissa in terms of the very high levels of discrimination in the housing sector against LGBT older adults, training is desperately needed. I want to turn now to Cheryl Whalen from Sage Metro St. Louis, which has been a leader in some of the early pioneering efforts to provide that training at the local level. I want to ask you, Cheryl, what kind of impact has Sage Metro St. Louis had by providing cultural competency training to housing providers where you live?
Thank you, Michael, for this opportunity to be here. I don't think that we can really overstate the importance of cultural competency training. So often when we walk into a housing community or another aging service provider, such as a home care agency, and we go in to train the staff, it's the first time that the staff have ever had a training on best practices for serving our LGBT older adults. And what we have found in the community in St. Louis is really a community of partners who want to work with us. They want to learn, they want to understand, and they want to provide the best care possible. So, this has really been critical for our work in the St. Louis region. And I think, it's also important to note, as Cheryl just stated, we can't build enough LGBT-friendly housing to adequately support the millions of LGBT older adults. And so through the work of the National Resource Center on LGBT Aging, we have the opportunity to go into housing facilities within our communities, large and small, and provide training that is research-based and tested and consistent. And the National Resource Center has trainers across the U.S. that are here to really bring this training to our communities. And that's important because so many of our older adults, they want to age in place. They want to stay in their communities, near their families, their friends, their neighbors, and to know that they have access to quality care and providers that understand what their specific needs and concerns are. A quick example, in St. Louis, we recently had the opportunity to work with a SAGE constituent who was needing long-term care, needing to go into a skilled nursing facility. And so we reached out to one of our providers on his behalf, and this was a provider that we had trained about 4 years ago. They immediately recognized who we were, and they said, please do not hesitate to refer people to us when they're in need of supportive care. They are always welcomed here. This is the response that we need in communities large and small across the United States. And this can only be done by providing the cultural competency training that the National Resource Center offers. So that's really been key in our community.
What about the kind of information that LGBT older adults themselves need in order to be properly equipped to maximize their housing choices?
We're entering the first time in history where LGBT older adults have laws that protect them in housing, that protect them from abuse, neglect, and harassment. And when those laws come about, it's really essential that we also train our LGBT older adults and educate them about these new rights and regulations. And so a couple of things that we've done in St. Louis specifically is we developed a Know Your Rights brochure And in this brochure, we've listed all the local municipalities that have non-discrimination housing ordinances, so that our older adults know these are communities where we know we have added protections. We also provide information about, how they can advocate for themselves and seek, legal guidance and support should they face discrimination or harassment. A second part that we're doing is developing a program called Sage Advocates. And through that program, we'll have highly trained volunteers who also understand the rules and regulations that are there to protect our older adults, specifically those going into long-term care, because that really is an area where I think our community has the most fear and sometimes feel that we're most vulnerable. So to know that we have advocates that can be there as an ally for our LGBT older adults and help them, through that process, and if they face discrimination or harassment, they're there to advocate with them and make sure that, they're seeking the legal guidance and support that's available to them.
Great, thank you. Kathleen, the LA LGBT Center is the sponsor of the country's very first LGBT elder housing at Triangle Square. Can you share a little bit about what the impact of that, of Triangle Square and the housing has been?
So I think that actually Marty, who we saw here, said it very well, that she wanted to live in a place where she could have her dignity. But what does that really mean? I'm also a researcher and actually was fortunate enough to do research at Triangle Square many years ago. And what I found was that in the communities or in an environment that is socially supportive of LGBT older adults, they actually start to thrive. They are more open. They're able to actually develop social support networks where otherwise they were unable to. And one thing that we have found throughout the country, certainly not just in Los Angeles, is that older LGBT adults primarily live alone. And we know that living alone, that having no sense of belonging actually increases someone's likelihood of death. 45% greater likelihood of death if you have no sense of belonging and no sense of community. What Triangle Square has done has actually afforded LGBT seniors in Los Angeles, only 106, out of 11 million people, but it has created an environment that is socially supportive of folks. So for instance, I was talking to some of our seniors before I came here. One of our seniors, Andy, talked about how curative it was for her when she moved into Triangle Square after losing her partner of 35 years and being able to sit with other LGBT seniors and talk about her life partner and talk about the sense of loss that she had. And they got together and actually formed their own support group. Or another one of our seniors talking about how he had always lived in an environment that he felt was very homophobic, and that this was the first time as a 75-year-old man that he had lived someplace where he felt he could hold his head up high, connect to other people, and really start socializing with those folks around him. I think not having the burden of keeping a secret about who you are is really transformational for our seniors. And there are lots of stories, and I'm sure Sage has a lot of stories as well about how transformational it can be. It's sad in a way that these folks are waiting until they're in their 70s or 80s to finally be in an environment where they feel that they can fully be themselves. They don't have to self-censor themselves. But that is a fortunate thing on the other side, because at least there is that opportunity in this particular environment to do that.
Great, thank you. And I know that there are plans to build on this work in Los Angeles. Can you say a little bit about that, Kathleen, and why those plans are in existence?
Sure. So we, the Los Angeles LGBT Center provides the social services and is the managing general partner of Triangle Square. And for 4 years, we have been working to develop additional senior housing. We also have very large youth programs. So this housing is actually going to be intergenerational housing. We'll have 100 units of housing for LGBT seniors and 40 permanent supportive housing units for youth and then transitional age youth. And the idea really is, just like Triangle Square has really been an example for other communities across the country, is to see whether or not we can create yet another example in Los Angeles with wraparound services for both youth and for seniors, and really offer this intergenerational mix. One thing we found is that young LGBT people really love to be with older LGBT people, and vice versa. They love to share their lingo, and the youth, really like supporting the seniors, but oftentimes they don't have an opportunity to interact. So the senior portion is what I particularly am working on, so we'll have our own standalone senior center that will be connected to the housing as well, so that we're really trying to create an environment where people from the outside who are really coming into day services can interact with people that are in the housing environment, and then also the youth that are going to be living in the youth housing as well.
All right, thank you, Michael, for inviting me to participate in this. To answer your question quickly, I think it's an emerging trend in the affordable housing industry, which is a very small industry when we want to use the word industry. There are basically mission-driven, nonprofit housing developers like Help USA, and there are for-profit housing developers. Both of us, the for-profits and the nonprofits, exist within a world of policy that's set at the federal level and then trickles down to the state and municipality level. One of the things that we're seeing is an increased attention being paid to the needs of LGBT senior housing. We've seen a couple new projects appear in other cities, and we are seeing more people thinking about doing it. That said, there are no real special set-asides or special resources being devoted to LGBT senior housing. To give a couple examples, Help USA, as a mission-driven nonprofit, started our operations in 1986 in response to the homelessness crisis that was, well, I don't want to speak of it in the past tense, but that was particularly acute in the mid-'80s. I'm not sure that it's significantly better now here in New York City, but we began by developing some of the first supportive housing for homeless families. We then transitioned into some of the first supportive housing for HIV and AIDS, and later on veterans housing. To speak to housing policy and the way the affordable housing industry can address a problem, I think a good example is to look at the affordable housing industry's response to homeless veterans in the country, both at the federal level and at the state level. I would say a tremendous amount of resources has been made available to eliminate homelessness amongst veterans, mainly through the efforts of HUD and the Veterans Administration, through the issuance of special tenant-based and project-based Section 8 vouchers called HUD-VASH. Developers across the country, and in some cases like recently in New Orleans, have effectively ended veterans homelessness. We don't have those types of resources at our disposal for LGBT seniors or really any other population. But that doesn't mean that there's not avenues in which to do this work. Under the current tools that we do have, the low-income housing tax credit program being the primary driver, and then local state and city resources, we have an ability to do some of these projects, but like some of the other panelists have said, it's not going to alleviate the problem. But I do think that we're going to start seeing more of this in the affordable housing world. But it's not going to work, I don't think, unless there is very significant attention to the services that need to be provided amongst for the population in the building, and also amongst the staff, so that people know how and what to do. In certain circumstances, each population in a supportive housing environment has different sets of needs. So what might work for a building that is housing homeless families might not work for a building that's housing LGBT seniors. So education is going to be a critical component to making these projects a success.
And David, I'm glad that you raised the issue of homelessness, because what we know is that is unfortunately all too often the end result of the kinds of challenges that LGBT older adults face. We saw that story in the story of Sophia Torres here in New York City, and last year a study was done in San Francisco looking at the incidence of homelessness among LGBT people, and the researchers were very surprised to find that very high levels of LGBT older adults were included in homelessness in San Francisco, and we know that that is not a problem unique to San Francisco.
Well, you put together a rock star panel, so it's great just to be here with folks and all the incredible work that you're doing around education, enforcement, advocacy, and the construction of more housing. So terrific to be up here. I guess what I want to say is, while HUD and VA are happy to take credit for the progress that we've made on veterans homelessness, the reason the investments have been made is because there's been bipartisan support in Congress for these investments. There are other places where we are asking, and we don't see that level of bipartisan support. Aging is a nonpartisan issue. LGBTQ is a nonpartisan issue. The need for more affordable housing needs to become a nonpartisan or bipartisan issue. And I think that, yes, HUD has more than $600 million more in its budget today to end veterans homelessness because there has been that kind of consensus built across the country and with Congress on the importance of that. And we need to use that as a model to understand how to build a consensus. I was struck, I twinged, but I was struck by your phrase that the federal government sets the policy and then it trickles down. It would flow down if we had policymakers who stood with us and understood that this requires not only significant leadership to say that these are policy priorities in underserved populations, but also that these investments have a return in terms of the quality of life of individuals, the quality of our communities, and dealing with the imminent problems to the healthcare system if we don't solve for it now. So I just say we need your help in terms of educating the public as a whole and our policymakers about the fact that that dealing with the creation of more affordable housing for everyone, for LGBTQ elders in particular, but for everyone, needs to become a national priority and not become a part of the bipartisan bickering that really has become way too common. We've seen what happens when we overcome that bickering. So I just, I'll use my moment here just to say that I hope that a part of the education effort here really does focus on building the type of campaign to understand that this is a need that's undeniable. It's a need that can be met, but it's one that's going to require investment, and but it's an investment with a return. So.
Right, that's great. Thank you, and certainly, absolutely, that is part of our work. And Aaron Tax, who's SAGE's Director of Federal Relations, is here and will be helping to lead those efforts in conversations with federal policymakers in DC. At this point, I want to ask Jesse to go to the slides. You see some great progress has been made in a small number of cities across the country. So in terms of continuing to expand and build on that, SAGE will be building LGBT elder housing itself in partnership in select cities across the country. We will look to share the lessons from our model and our experiences to help other communities across the country. We will support other partners and other organizations like the LA LGBT Center in sharing their models and sharing their expertise across the country. One example of how we can do this work is through the White House LGBT Elder Housing Summit, which, as Jennifer mentioned, is happening next Tuesday, which is a first step in this direction of creating the platforms that we need to share the expertise so that this progress can really ramp up in a much faster and more dramatic way all across the country. Second key, we've already talked about it, training housing providers, and here we need both so-called cultural competency training, which has been a specialty of SAGE's National Resource Center on LGBT aging. So we need cultural competency training to work with providers, housing providers, in order to encourage them to work effectively with LGBT older adults across the country. And we obviously have legal compliance issues, as been discussed earlier. So we need legal compliance training in those jurisdictions across the country that do prohibit housing discrimination against LGBT older adults. Part of this involves creating training curriculum that is specifically designed for the housing setting. And we're pleased that the National Hispanic Council on Aging has agreed to host and pilot this new form of training in its senior residences in Washington, D.C. and Kansas City, so that we can construct appropriate training. And then we will take that training, working with our partners through webinars, through conferences, etc., across the country. Policy advocacy, the point that, that Jennifer Ho raised just a minute ago. Clearly, we have a lot of work to do in terms of adapting and advancing federal policy so that it supports and addresses the needs of the housing needs of LGBT older adults. Some of the key points in that policy agenda are reflected in the SAGE policy brief, which is in your folder. And we will have continual opportunities to do this work, including at this summer's White House conference on aging, where housing and the needs of LGBT older adults in housing is one of the key themes that SAGE is moving forward in that work. We also need to strengthen federal anti-discrimination protections. We do not have a federal civil rights law that prohibits discrimination against LGBT people in employment or housing or anything else for that matter. That legislation needs to be passed, and SAGE is working with a number of national LGBT organizations and allies on omnibus federal civil rights legislation that would include federal protection against discrimination in housing against LGBT folks. And third is that state and local policy advocacy is critically important. Much of the work that happens in this field happens at the state and local level. We know that we need to enact state and local anti-discrimination protections, among other things. And so we're pleased that SAGE's network of affiliates and in 27 cities and 20 states across the country has made housing and housing policy advocacy its top priority in its advocacy work for the next 2 years. A fourth key, educating LGBT older adults themselves. The fact is that we do have legal protections in many parts of this country. Many folks either are not aware of them or don't know how to exercise their rights. So know your rights education among LGBT older adults is important. It will be an important part of this initiative. The Equal Rights Center has done some excellent pioneering work in this area. We also, as Cheryl Whalen discussed earlier, need to do a lot more to educate, and will do a lot more to educate LGBT older folks in what resources are available and how to access them. And SAGE Metro Portland actually has done some great work in that area. So we need to do that work to educate consumers all across the country. This is just an example of the kind of educational work that we will do as we move forward in this initiative. And then the fifth key, and it's been touched on here by David and Kathleen, is the importance not just of building housing, not just of ensuring that housing is LGBT welcoming, but ensuring that appropriate services are available within that housing for all residents, including LGBT older folks. And this is going to be, again, a very important part of this initiative. Will be part of the work of our National Resource Center on LGBT aging, which actually specializes in providing the technical assistance to create those kinds of services. That's an example there of a National Resource Center guide that provides that kind of technical assistance. So, with that, I want to open it up to Q&A and give folks here. We'll start with any questions from media and then move on to any other questions that the folks may have. Paul.
Yeah, Michael, I just want to clarify. At the outset, you mentioned there would not be specific discussion of a project here in New York. You did mention a couple of details. Were those details off the record or on the record?
The fact that we are going to build a project in New York City in partnership with HELP, and that's going to be in the Bronx, that can be on the record.
I just want to clarify that.
Yes.
What other cities are you looking at and why?
So that's not quite on the record. So it really, we are looking at other cities, but really it's premature to discuss those since they involve a whole range of considerations, including discussions with local partners, etc. So we wouldn't want that appearing in the media before we've had those community-based discussions.
What does this initiative mean for low-income LGBT people in general?
Mm-hmm. So that's a really great question. I mean, until recently, certainly the experience of service-oriented organizations like SAGE, like the LA LGBT Center, is that we have very large challenges with poverty within the LGBT community. Until recently, we have not had any significant data to back that up. We've had our day-to-day experience. We now do have more of that data. The Williams Institute, which is a think tank out of UCLA, has done an excellent report on poverty among LGBT people, including highlighting higher levels of poverty among LGBT older people relative to older Americans in general, and that's especially true among older lesbians, among transgender older folks, and among LGBT elders of color. And so now it really is the responsibility of all of us to devise the strategies to address those poverty needs. Housing, affordable housing is one example, but it's obviously not the only example. Benefits counseling, case management, nutrition programs, these are all things that are being developed, not only here at SAGE, but in organizations across the country, including the LA Center. Kathleen, I don't know if you want to add anything to that.
Yeah, I think the one thing that I would add is that I think David actually mentioned this. There has been, I think really in the last year, which is kind of surprising, new momentum behind developing housing that is open and accepting of LGBT older adults, and for communities, LGBT community centers, to actually start partnering with local developers to actually build housing. So I think there is that momentum. There's also momentum, I think, from the housing side and from the healthcare side to really see housing as sort of a foundation for people's healthcare. And as we see people aging, and we want people to stay in their community and age in place, we want them also to be in the type of housing that's going to be supportive for them. So while we do see very high rates of poverty, 52% of the clients we serve in Los Angeles live on less than $2,000 a month, in one of the most expensive cities in the world. We also now are seeing, fortunately, this rise in interest to develop affordable housing that really is open and accepting. And I think that what is exciting for me, coming from Los Angeles, is that SAGE is really the national sort of champion for LGBT seniors. And so now that they are entering the housing and have laid out a plan for how we're actually going to develop this housing and work with local communities, I think we'll see even more momentum in the next year or two. It doesn't mean that housing is going to be built in the next year or two, because it takes a long time to develop housing, but at least there is going to be that spark and sort of that expertise coming from our national organization, which has been supporting LGBT seniors for over 40 years.
Just one thing to highlight on this before we move on to the next questions is that I think it was very important what Kathleen referenced earlier, that in the next building project in Los Angeles, part of the vision is to include a full-fledged senior center within the community itself, because we should be clear that we're not building buildings here, we're building communities, and communities require services on site, and that's especially true for lower income folks. Yes.
First of all, thank you for this wonderful work that you're doing. I was curious if you or some of the other people on the panel could talk about the role of gender expression in terms of research and policy and support, because as we know, there really is a feminization of poverty, and women, whether they're lesbian or not, experience a real economic disparity in the wider picture.
So let me just repeat or at least summarize the question, which is for if we could address the question of gender and gender identity and how it intersects in this kind of conversation, given, among other things, our experience and data around the feminization of poverty, et cetera. I will start that, and then I will open it to any other panelists who would like to pitch in. As I mentioned earlier, one of the most stark results of the Williams Institute's report on poverty among LGBT people was to see the dramatically higher levels of poverty among older lesbians, relative not only to older people in general, but relative to other older people in the LGBT community. And that reflects a couple of things that certainly are not surprising to those of us who've worked in this field. One, it reflects a lifetime of gender-based wage discrimination in the workplace. And so if we're looking at older lesbian couples, we see the accumulation of that lifetime of discrimination. It also reflects a broader problem that we see in terms of the lack of benefits and supports that are available to older women, including older lesbians. It's interesting to raise that question in the context of housing. I would say, more generally, at organizations like SAGE, and again with our partners across the country, we have worked in particular to build programming that is designed in particular to address issues of health among older lesbians, health and equity, social opportunities for people to come together. Edie herself was an incredible leader in the 1980s, and incredible organizing efforts among older lesbians here in New York City. There's a great tradition in this organization among our partners in seeking to address this issue, but as your question indicates, the issue is vast and needs to be an intentional lens needs to be brought in addressing it, not only in our programs, but in our housing, and it certainly will be part of what we're going to be looking at in the housing here in New York City.
Cheryl from Enterprise, you had mentioned two specific policies that you're, putting effort on helping to preserve. One of them was the low-income tax credit. You mentioned something else relative to HUD that I didn't catch.
The HUD 202 program is one of the primary ways historically that affordable housing for low-income older adults has been created. That program is no longer being funded for new construction, but continues to support existing units that are out there. So HUD is thinking about repositioning that program and what to do with it, and in particular thinking about potentially enhancing the service component of that program through a proposed demonstration that potentially will, I wish Jennifer were here, but to come out in this summer, potentially. So in thinking through that demonstration, thinking through how what the new HUD 202 program will look like, we just want to be sure that we're encouraging cultural competency and that LGBT people and their considerations are considered as that service demonstration is developed.
Okay. We have another question over here. Did you have a question? Oh, okay. Other questions?
How much does actually the mayor's office kind of wants to make in helping move this along?
I think if I heard your question correctly, it was how is the mayor's office helping to move this work along?
Yeah, with this big issue there.
Sure.
The mayor's office.
Oh, fantastic. So we were extremely pleased to see the decision by Mayor de Blasio and the de Blasio administration to include a specific provision in support of LGBT elder housing in the mayor's affordable housing plan. That is a big step forward, and I would say that was announced last spring, and since then it has opened the doors and substantially increased our engagement with various city agencies, with the New York City Council, etc. So I would say the mayor and the city council have been extremely supportive on this issue in general, and have been supportive of our discussions with regard to the project that we'll be building in the Bronx. And it's worth noting that the mayor at this very moment is doing his State of the City address, which is focused almost entirely on affordable housing. So we know in this city we have a champion in affordable housing in the mayor. Yes, sir.
Good morning. This is a fabulous conference. I'm Scott Seal. We do real estate development projects in urban New Jersey, and we're working on site acquisition on something in Jersey City. And I've gotten a lot of political and state support, and it would be a mixed income rental housing. What I understand is that you can't really discriminate using federal dollars, calling it LGBT. And I met with Mark Siegel in Philly, and it's interesting what he said is he literally took together a lot of people to be there when Agus applications opened for his housing project. So I wish Jennifer were here to hear this. Like, I know you can do affirmative marketing, but what else can you do specific to allow your project to be LGBT?
Right, so the question in sum is how to create LGBT elder housing knowing that we cannot run afoul of housing discrimination protections in federally funded projects. And I think we need to be clear here that in any of our housing developments across the country, we are not talking about LGBT exclusive housing. This is not exclusionary housing. This is housing that is being designed with a particular population with a particular set of needs in mind. But there is no exclusion of any individual based on their sexual orientation or gender identity. And that's not a new concept for us. We are sitting, for example, in the country's first full-fledged LGBT senior center. This is an LGBT senior center, but we do not exclude and deny other individuals who seek access to these services. And in fact, we have a full range of individuals who participate in these services and in those across the country. So we're confident in what we've seen in Los Angeles and Philadelphia and Minneapolis and Chicago, where LGBT elder housing has been built, is that it's not only possible, but in fact it's been done, that we have created this housing and still been consistent with federal fair housing requirements. And we'd be happy to talk with you more about some of that, some of how that work has been done. Yes?
Do you have a plan for like the suburbs? It makes sense to concentrate on big population centers, but what about LGBT seniors living in areas that are, where they might even be more isolated in the suburbs?
Sure. So I will to summarize the question. Does this plan include thinking about LGBT older folks in the suburbs? And I'd say a little bit, and then see if anybody else on the panel wants to add anything to that. One is that this kind of housing tends to be easier to build in urban areas for reasons that are probably obvious. And let's also remember that as panelists have talked about, the vast majority of LGBT older people are not going to live in specifically designed LGBT elder housing. They're going to live in the same kind of housing that other older Americans live. And so key to that work is the kind of cultural competency training work that we have described to ensure that we can create a better housing experience for all LGBT older people. Having said that, I think in particular on one of the four projects that's up and running is Spirit on the Lake on the outskirts of Minneapolis, which is actually still an urban area, but is not as dense as some of the others are. So we've seen some early models in that regard. And certainly I think as this work builds, there may be possibilities in suburban areas as well. But I think I would probably come back to the fact that 99% or more of LGBT older folks are going to live in the same kind of housing as everybody else, whether they're in suburban, rural, or urban areas, and that's got to be a big focus of our training. If let's see, go David and Cheryl.
Yeah, I was just going to say that in our experience as supportive housing providers, it's increasingly difficult to do projects in suburban areas, mainly because of the population that we're working with and access to transportation and access to other services that they're going to need. And also municipal support. The urban areas tend to have a more sophisticated history of funding affordable housing projects and have plans and processes in place for acquiring the financing that you need to do the project. Oftentimes suburban areas don't have those resources at all, or they're very limited.
Okay, Michelle, do you want to say something?
Yeah. And I think St. Louis is kind of a perfect example of really what I call more of a suburban area. We have a smaller urban corridor, but a majority of our older adults are living in suburban areas. So building partnerships with existing providers that provide long-term care, residential, home care, hospice, all of those types of services, it's critical in suburban areas that we're developing those relationships, providing cultural competency training, and allowing people options about where they receive their care and what that looks like.
So let me take this a question. We have a question that's been written in from Atlantic City from media there, which is asking about successful models in specific cities that are serving as a template for projects, presumably like the kind of construction of LGBT elder housing that we're talking about here. So Kathleen, I would pass that one back over to you as the first template in the country.
Well, I think that what I would say is that every city is different, every state is different. Los Angeles could no longer build Triangle Square using the same type of funding it did 8-9 years ago, because we no longer have community redevelopment agencies. Those were done away with by our governor. So really, there isn't going to be one model of funding, because there are different avenues for funding based on where you're trying to do the development. But I think that there are some just key components about partnering with a developer, maybe one who's mission-driven, so that the emphasis can really be put on not just building the building, but as Michael said, creating the community. And I think that that's a piece that maybe a lot of communities haven't thought about. We have 3 full-time staff on site at Triangle Square to actually provide the services for people who are very low income. 75% of the residents at Triangle Square are at the poverty level or below. So there's a lot of issues that come along with poverty for everybody, but particularly for older adults. In Los Angeles, we have partnered with a wonderful developer, Tom Safran and Associates, but we're doing something that's really kind of out of the box, because it's combining housing and tax increment financing for the senior portion. That's one sort of conduized piece of this entire development. And then we have youth housing, and that is going to be funded in 3 different ways, because it's 3 different types of youth housing. And then we're raising, with a capital campaign that's actually going to be raising money to develop a senior center and then our youth services center. So I don't think there are many communities that actually could model what the Los Angeles LGBT Center is doing, but there might be components that people could take of that. And I think one of the components is, you know, making sure you're partnering with a developer that, you know, you're happy having a 40-year relationship with, so longer than many marriages, and also ensuring that the developer really understands what supportive services are, that they are supporting services within the building and to the population that you are providing services to. There's one other thing that I wanted to just latch on and just say out loud, which was that the building at Triangle Square is really focused on providing housing for people who are HIV positive. So there are also HOPWA funds that can help both with people's rental assistance, and so it's a Section 8 program, but then also can help to fund services, which people in their local communities have to apply for locally. But that is one way that we're actually able to provide high level of services, particularly for our long-term survivors of HIV. No one had said HOPWA, we talked a little bit about that, so I just wanted to throw that out as well.
Great, and this would actually be a good moment for me to say that the initiative that we're launching today will be advised by a National Advisory Council, which will include representatives from the various LGBT elder housing projects that are up and running now around the country, as well as a couple of the different folks who are in the midst of doing it. So I just want to mention that in addition to the LA Center, that would include Center in Halstead, who is running the town hall residence in Chicago, Spirit on the Lake in Minneapolis, John C. Anderson Apartments in Philadelphia, and of course Triangle Square and the LA LGBT Center. The National Advisory Council will also welcome Open House, which has a project underway in San Francisco, and Mary's House in Washington, D.C., along with the National Hispanic Council on Aging. Other questions?
Just to piggyback on the funding question, what kind of funding sources are you looking at for the initiative, for the new development specifically, or can you elaborate on that at all?
So for the initiative itself, we will be relying primarily on private foundation funding and individual contributions, which is the way that most of the work at an organization like SAGE is funded. With regard to what we're ultimately planning on doing here in New York City, David, do you want to?
Yeah, we intend to finance this project the same way. Really, the majority of affordable housing gets financed anymore, which is the low-income housing tax credit program, supplemented by hopefully loan funds from the City of New York, and then backing in and filling in the gap with, we'll reach out to council and borough presidents to see if we can get some funds from those resources, and then whatever's left over as a gap we usually fill with private foundations.
Hi, thanks to Edie here, we have the wonderful privilege now to marry in a good percentage of the country. But I am wondering how that can be, work both the positive in terms of applying for housing, but if in some cases it may be difficult, if they might say if a couple comes to apply for housing, they're not married, and it may be to their advantage not to get married because of whatever finances, if they could be discriminated against on that fact because they have the right to marry and yet they're not. Can housing discriminate to a couple on that basis?
So to repeat the question is with the increasing availability of recognition of marriage by same-sex couples, to what degree might that be an advantage, a disadvantage, or neither in terms of qualifying for affordable housing?
I don't think that I think it's a neutral issue. When we finance these projects under the federal low-income housing tax credit program, there are income guidelines that we have to adhere to that are set by the federal government based on what the area median income is and based on household size. So a married couple coming in would have to qualify under the income guidelines if they both have income or both have some sort of whatever their family income would have to be below the threshold, just as if they were two non-married roommates. They would have to combined meet the income requirements. So I don't think that's not an issue.
We have time for one more question if there is one. Yeah, Frank.
We've discussed affordable housing here. What about housing for LGBTQ people who have the funds to live well but want to be in a community or have a need to be in a community? Is that part of this, or is it all affordable housing?
So the question is, we've had a focus here on affordable housing for LGBT older adults, but what about for LGBT older folks who are not low income but still have a desire and a need to build community? And what I would start that in terms of the initiative as a whole, and then see if panelists want to add into that, is certainly in terms of SAGE's work and our work on the initiative, we recognize that there is a need for not just housing, but as we discussed earlier, community building and the opportunity for welcoming communities among all LGBT older people. Especially with regard to the training that is going to be done among in housing communities across the country, certainly we will not draw a line at affordable housing, and we'll be focused as well on doing that kind of training, that kind of technical assistance in any kind of community where LGBT older folks are likely to live. The considerations around the construction of LGBT specific older adult housing are a different set of considerations that may make that answer more complicated. But again, a substantial part of the work here is on training and policy advocacy, and that will be designed to benefit LGBT folks at all levels. Okay, so I'm going to do one more, and then we really will stop this chick.
Apologies. Congratulations on this very creative initiative. My question really has to do with what is the general priority given to establishing a continuity of care from independent living all the way to, say, through assisted and palliative and hospice care. My question comes from two perspectives. One is as a lifelong healthcare reform advocate, where the whole thrust of reform is going to be about keeping people out of hospitals, out of nursing homes, out of all that high-cost care, and keeping people in the community. And from a personal perspective, I'm a transgender individual. I'm a stage 4 cancer patient. In my second cancer, facing both disability and the destitution that comes with cancer and disability. And I have a partner who died of horrific abuse in a nursing home. So I have the typical horror, terror, fear of ever being dependent on service providers who are going to abuse me, neglect me, and allow me to die in horrific conditions. So I'm very aware that in terms of patient preferences, very often we align what we want as individuals, which is to live at home, have our services in the home, with culturally competent providers, living in safety, dignity, all the way to having our death be one with dignity and care surrounding us. So I optimally would love to see housing that provides across that whole continuity of care, and no one knows better than the AIDS generation how critical housing is as that foundation to healthcare. So I'm just putting that out there for anyone who wants to address that vision.
So to summarize that question, it's one about the intersection between housing and long-term care, and asking for folks to comment on the notion of continuum of care in this context. And ask anybody on the panelist if they have thoughts, and then I will wrap it up.
I'm the gerontologist, I guess, on the panel. So this is what I study. And, you know, unfortunately, not just in the LGBT community, but really in the broader senior community, unless you're very wealthy and you can buy into a continuing care retirement community, you're not going to have the experience where you can go from independent living to assisted living, maybe a memory care unit, or skilled nursing. So right now, nationally, there isn't that type of continuum of care. I was just actually speaking with Catherine Thurston, who you probably know from SAGE, this morning, and this is exactly what we were talking about. And I think that it is something that our community, as we launch this initiative, we're also launching a whole set of new questions that are going to require some answers. And one of them is, what happens in our housing when someone is no longer able to be independent, despite all of the efforts of our service providers, despite the efforts of in-home health and social services coming into a person's apartment, they just can't remain independent anymore. What do we do with them? Where does that person go so that they are still safe and they still have a sense of belonging, they still have a sense of community, and they can still be out in who they are? And I don't think that we really have a good question to that, or a good answer to that, other than the trainings that Cheryl is doing, the National Resource Center is doing, organizations like the Los Angeles LGBT Centers and others across the country who really, you know, I think it started in Boulder with Project Divisibility back in the 80s of training nursing homes and assisted living communities to be culturally competent. I don't think that really answers your question. And I don't think that we have just the perfect answer right now. It takes an enormous amount of effort to go out and do these trainings and to develop the referral list in local communities. I think staying connected, so if you're in New York City, staying connected to SAGE as you go through that process would be something that I would recommend. But it is definitely something we struggle with. You know, we have 50 providers of care, assisted living and nursing homes that have been trained by the Los Angeles LGBT Center. That's not nearly enough, and we try to get back there every year to do a refresher because staff change. But it's not perfect right now, and maybe at some point we do want to consider creating a model of an assisted living, how you make an assisted living community work, or partner with an organization like Concepts for Community Living in Portland that really is developing fully functional, accepting communities.
And this is the work that we will are describing, that we will be undertaking through this initiative. We also are issuing really an invitation for leadership among entities and partners and potential partners and communities across this country, because this is a huge, huge challenge that extends well beyond so-called independent living. And as I, for example, here in New York City, we at SAGE have been working closely with Jewish Home Life Care, which is working to implement plans to create an LGBT skilled nursing facility as part of a new campus. That's one example of how a partner, a potential partner, can provide leadership to really ultimately seek to address the broad continuum of care that's so critical to our community. So with that, I want to thank everybody for being here. I want to thank this incredible panel of experts for your